And then, so I was pulling numbers yesterday on this new, agent AI, this agent chatbot, which is basically serving as a customer service agent. We've had 700 and something questions, 500 and something conversations in less than 30 days off of the website. And this is where it's going. And then you take it to that next level, which is kind of like Agentic AI 2.0. And that's kind of the stuff that we're seeing that people are really starting to talk about. Hey there, welcome to the Dr. Marketing Tips podcast. I am Jennifer.
And I'm Corey.
And today we are talking about AI and something referred to as Agentic AI. It's not that difficult. I think it's difficult to say, but I do think it's potentially going to be a game changer. And really, we're going to dive into like chatbots and some case studies that we've, some recent experiences. I think we should just start over.
Okay.
Because I also said the name of the show wrong.
Oh, did you? I didn't even notice.
Yeah, I know you didn't notice that.
I did not.
All right. 3, 2, 1. Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
And today we're exploring a transformative shift potentially in health tech. It's one that's being driven by rapid advancements and artificial intelligence. AI isn't just about enhancing our existing systems anymore. It's about evolving into something that's being referred to as Agentic AI. I was in Las Vegas this past week at the National MGMA Operations Conference, and next to us was the HIMSS conference. And apparently all the scuttlebutt at the HIMSS conference, which is really the technology of healthcare, all your IT folks, all the people like responsible for interoperability and things of that nature, they were talking about Agentic AI across the board. While I was over at the smaller MGMA conference talking about AI and how we can use it for our independent practices. So I'm on the main stage here and they're on like 15 main stages next door. Everybody's talking about the same thing. So we thought it made sense to talk about it right here in this episode.
Yeah, and I think the thing to know with what we're talking about, so this rise in AI, that's your ChatGPT, Claude, Gemini, Apple Intelligence, which of course they have a name for it. That's one thing. And then the next sort of potential game changer, evolution, whatever you want to call it, is the Agentic AI, which essentially means that the AI can operate more autonomously, actually learn, and then do things for you. In other words, it can help make decisions. So think of it like, if you go to ChatGPT, you could say, hey, I need a piece of content. I'm a spine surgeon and I want to write about kyphoplasty. Okay, cool. It's going to write an article and then you can take that, tweak it, post it, whatever. That's just typical like AI. Agentic AI, you could say, I am looking to use a real world example. You could say, I'm looking to book dinner for 2 at this restaurant, needs to be 6 o'clock. My dates are flexible. And the Agentic AI will go and actually look through the calendar, pick a time, and then book it for you and say, great, you're set for the 23rd at 6:30 p.m. If you have any changes, let me know. And so what's going to happen is that Agentic AI is right now anyway, being trained and starting to come out for healthcare to say, well, how can we help patients this way? And we'll talk a little bit more about what some of those examples are, but I just wanted to kind of set the stage for what the differences are in terms of the technology.
And this isn't like future casting stuff.
No, it's like 6 months from now.
Like right now. It's by the time this comes out, it's probably already happening because we're recording this March 12th. And so this will probably come out at some point in April, and we're already going to be leaps and bounds. And so, I'm gonna liken it to like chatbots because I think everybody can understand a chatbot. So we have a practice that we're working with that, I don't know, late last year they said, and we'll do a case study on this later, but late last year they wanted to launch a new chatbot so that we could start interacting directly with patients. And we had kind of 2 avenues that we could take. There's a chatbot where the chatbot is just a chatbot and it's answering questions so that we could help patients get the answers they want, but also we could relieve some pressure from the call centers, from the call folks. And so literally, let's call it October of last year, we start working on the chatbot. And at that point, the entire process was we loaded the questions. We chose the questions that we thought patients might ask. I had to go to every department at this practice, and I had to get with the department heads and have them add questions and answers. Then I had to go clean up those questions and answers, load it up to the system, and that was how the chatbot was going to answer. So if they said, like, do you take Blue Cross Blue Shield, the chatbot had an answer because I got that from the insurance department. And then we go to launch the chatbot, which was, we had like 150 questions. We go to launch it, or we go to demo it in front of leadership, and the damn thing didn't work. Every time they tried to stump it, it got stumped and it didn't work. That's how fast things have changed, because literally this was October. I think in November, we went back to our vendor and we're like, this is not working the way it should. They said, yeah, but we have this new AI version. Try this. Now the AI version, you can't stump it, and it will answer every question because it's crawling the interwebs, getting the answers from your website or from what. So we're giving it questions that it can answer from, plus it's crawling the interwebs, and it's now answering in every language. And we had to have people check it that spoke that language natively. It's answering it flawlessly.
Mhm.
It's answering questions after hours. People are asking how they can make an appointment. It's taking them to the right pages. And then, so I was pulling numbers yesterday on this new, agent AI, this agent chatbot, which is basically serving as a customer service agent. We've had 700 and something questions, 500 and something conversations in less than 30 days off of the website. And this is where it's going. And then you take it to that next level, which is kind of like Agentic AI 2.0. And that's kind of the stuff that we're seeing that people are really starting to talk about.
Yeah, that's a great way to phrase that, is the 2.0 version. And so just thinking about how that can enhance operational efficiency, improve patient care. Think of having that same conversation where you're saying, like, hey, my knee hurts, what can I do? And it gives you some answers based on the website. But then you say, well, I'd like to book an appointment. And the Agentic AI can actually has interoperability with your EHR, and it can say, okay, you want to see Dr. Jones February 7th at 9 a.m. Does that work for you? And it'll actually book the whole thing. It can send the paperwork so that the patient can then fill it out. This is all HIPAA compliant, of course. So what's nice too is what we're seeing is these, depending on how you set it up, these agents can sort of travel with the patient. So I could start this conversation on my desktop, and it asks me for, let's say, a phone number or email or something. Then on my phone later, I could start the conversation again, put in my phone number, or it might even recognize that I'm on my mobile device, and it'll say, oh, hey, welcome back. Here's where we left off. I can finish once I'm done. So that improves the patient experience for me, because I can do it from anywhere. When I've got a few minutes, I can get all my paperwork done, whatever. And then from an operational side, what it's actually doing is it booked an appointment, it created a chart, it uploaded all of the relevant paperwork and my initial notes for my primary complaint, and no one had to do anything. Now I'm booked, so I'm happy as a patient because I did that at 9:30 at night. Your team's happy because it saved them a phone call. And your doctors are happy because their clinic has a new patient, their schedule has a new patient. And so that's sort of the evolution that's happening, like right now as we are recording this.
Yeah, so I think there's three kind of pieces of the evolution. There's the example I gave, which is just a chatbot that is using AI to basically answer any and every question. And then if they can't answer the questions, it's pushing to either email this person or call this number. That's basically, it's one-sided. Chatbot's trained. It can answer in any language, whatever, 24 hours a day, and it's working. And it's working, by the way, folks, for a couple $100 a month. That is
not crazy.
It is not
it's
any
less than you think.
It is ridiculous. You should have this. And then the next phase of that is kind of human interaction and chatbot. And so the practice I'm referring to in particular has opted not to turn on the human interaction just because it disrupts workflow, and they're going through a transition to next gen, and it's a nightmare, and they're just saying like, we can't take on anything else. So, but in that world, you can use your chatbot functionality, your dashboard, as kind of like air traffic control. And so when something comes in that's patient focused during business hours, if it's a billing question per se, you can literally transfer that digital call, that conversation to your billing department, and they can go from automated chatbot to live chatbot in real time on your website to be able to answer those questions. And it's not that far-fetched and that different than answering phone calls, but now you've got somebody who has a like a virtual call transferred to them, and they start having a conversation from a chatbot perspective, and it's totally HIPAA compliant. And then what you're talking about, Corey, is that thing that's going to happen 2 months from now.
Yeah, which so far in the future.
Yeah, it's so far in the future, but it is. But don't you have a practice that you work with that kind of uses the human interaction along with the chatbot, don't you?
Yes. So what they do is the conversation starts, and then the AI kind of picks it up and runs with it. At any point, a human can be monitoring that. And for business hours, they have someone that will actually like jump in and just sort of take over. Or it's sort of the chatbot equivalent of press 0 to talk to someone. So you can say, I want to talk to a live person, which, if you're watching this, you probably have that experience in your day-to-day. And then if it's during normal business hours, someone can actually, basically it goes into a universal inbox, and someone can hop in there and they'll say, oh, hey, this is so-and-so. And in this example, it's actually a pharmacy group. And there's about 6 pharmacists here, and they rotate through which one of them is going to monitor. So if an inquiry comes in that's relevant to them, they'll grab it, respond to it, and then help out the provider. Because what they do, it's actually it's B2B. So they're just talking to referring providers. So they'll help out the referring provider and then close the ticket essentially. But it is you're talking to a high level decision maker every time you use this chat function. And if it's after hours, it just simply says, hey, no one's monitoring this right now, so we'll get back to you as soon as we can. Again, it goes right into that inbox. So the next morning, whoever is essentially on call to watch the chat at that time hops in, runs through the messages, and then goes on with their day. I also have had conversations with a large mental health group. They're talking about doing the chatbot and figuring out how, from an operational side, that because they want to do that. They want to have the ability for someone to step in. And what they're kind of leaning toward is, if this is going to reduce our call volume by X%, that means that people in the call center now are going to have Y% of time available. And so we'll train them to actually have these initial conversations. So they already more or less have the team in place, and they're just trying to figure out how much time do we save on the phones to open up time on the chat, and and then we'll work through whatever whatever kind of comes with that in terms of staffing volume and inquiries and what have you. But yeah, really interesting to see how different people are using it.
Yeah, and you different episode for a different day, maybe one of our upcoming case studies. I used in my MGMA talk a couple weeks ago, I used the pharmacy example that's working directly with the providers, using the chatbot to communicate with providers as part of their like referral strategy. I used that as an example in my talk, and I pulled the numbers. They launched it in July of last year. And between July and the end of the year, they had 700 physician interactions. You can't do better referral marketing than something like that. And I just wonder, how can the average specialty practice use a similar approach to make, to help differentiate themselves as this independent group when they're doing referral marketing? And a different episode for a different day, but it's all being driven because of this agentic approach, or this chatbot approach.
Yeah, I will say that one of the tenets that they lean on is that we have better access. That's something that they talk about in their marketing to patients and to referring providers. And this is kind of like where the rubber meets the road. They're actually walking the walk, talking the talk, and providing this different access. And I think when you're looking at, tangible, intangible benefits of this kind of technology, that's what it is. Because again, if you're saying you're a leading edge provider, you have the most innovative, minimally invasive, blah, 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 but then you don't have something like this on your website, it just creates a dissonance because you're not leading edge if you don't have this. So I think, if you are going to focus on these things, it's just, fortunately or unfortunately, another tool in the toolbox that you need to have.
So let's talk about the third phase of agentic AI, which is what's going to be happening in 2 weeks or whenever. That's how
I like how we keep moving the goalposts.
It happened this morning.
Tomorrow.
So I was meeting with a practice CEO yesterday, and actually the one that we just launched this chatbot on, because I'm paying attention to the chatbot because I've got to report to the doctors in a few weeks. And dollar for dollar, I think it really is going to make a difference, and it's going to help with the patient experience and that call volume stuff. But he's the one going through a transition over to a new EHR. And in part of that EHR conversation, they found out after they signed the deal that the online scheduling platform isn't built into the EHR. It's actually another vendor that they have to work with. So I started fiddling around looking at all these vendors yesterday. And the one thing I really take note of is every one of them says they're integrated and they're using AI to help with exactly the stuff that we're talking about, and that they're solving the interoperability challenge. But the reality is we all know that people are moving, everything is moving at the speed of light, and nothing is fully vetted. And so jumping ship and saying I'm going to go do this with my new provider or my new vendor or something like that, there's going to be hiccups along the way. And so I think that if we want to dip our toes into this agentic AI, or dip our toes into anything, start with the easy stuff that's kind of tried and true, and then just be aware that this is all shifting over, because we don't fully know how it works, and we also don't fully know if over automation or over making it super easy, what we think it's easy, but if this over automation actually turns off the patient or not. We don't know those answers yet. And so we have to keep all of that in mind. Just because someone says they can do something, it may not be 100% there yet.
Yeah, that's a really good point. I think, I was talking with a AI vendor a couple of weeks ago, and we walked through a demo, and he was showing me, and he was all excited about this new technology where it's an AI agent that you can talk to on the phone.
It's voice, right? Because that's the piece we're not even talking about yet.
Yep, and it does everything we just talked about from an agentic standpoint. It can still book, it can still see the EHR, all those things, but it obviously lets you know that it's AI, but it will handle phone calls. And I think to your point on, we aren't sure where the tipping point is. That's just something we're going to have to wait and see, because some people are going to be totally fine with that. Some people are going to be really turned off that they're talking to a robot, and they won't want to do that to book their appointments. But the same thing could have been said a couple of years ago about online scheduling. And we know now that, 60+% of appointments are made online if given the option. So, I think it just comes back to that. Staying ahead means that you're continuously adapting your strategy, and there's going to be bumps along the road, but know that this is coming. It's more affordable than you think somehow. That when I see the prices on these things, it boggles my mind. I'm like, you're only charging how much for this? But anyway, that shift to AI, it's changing behavior. People are becoming more and more used to it. And it's something that we as marketers and you as healthcare professionals need to pay attention to, because that is, it is an arrow that we're going to have to use. It's coming.
It absolutely is. And I mean, you can kind of see the writing on the wall.
Mm-hmm.
I was watching a news story this morning, which kind of blew me away a little. And it was talking about, it was the newscasters on the regular TV news early, talking about how news outlets right now are experimenting with AI reporters. It's not, they have, so there was talking about one of the national news agents, outlets, and they have 2 agents, one's male, one's female. And basically they're feeding it copy. And the AI agent, the AI reporter is on a news screen in the background and you can't tell the difference.
Yeah.
And so this is coming and technology is coming and everything's changing. It's good for us to understand it. It's also good for us to think, how can we use this tech in our existing workflow to make improvements, but not necessarily blow up everything to figure out, like, we don't want to just jump on board because it's some new shiny thing. We want this to make our lives better, easier for the doctors, for our employees, for our management team, and for our patients across the board. So lots of good things coming, some new case studies that we're going to bring out, but I'm excited to see where this takes us, Corey. I think it's a big game changer and we are paying attention to it. And so should our listeners and watchers. So with that, I'm Jennifer.
I'm Corey.
And we'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Bye, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.